Hi, how are you?
Good. My name's Melissa. I'll be picking on you a little bit.
Hi, Melissa. How are you?
Good. For your safety, can you confirm your name and date of birth for me, please?
J. Perry, 10/26, 1956.
10/26/56. Jay Perry, right?
Yes, ma'am.
Yes, sir. Come on in, have a seat wherever you're comfortable.
All right, thank you.
You're very welcome.
Right here.
Absolutely. And we are reviewing a MRI of your lumbar spine today. Is that correct?
Yes, that's correct. Dr. Carlson, this is work comp injury, you know that. I had to be hospitalized between my last visit and now.
Okay.
It's all in the notes at St. Luke's and KU. The notes are all combined, thanks to my doctors at St. Luke's. I had to be hospitalized because of severe pain.
Okay.
I had an injection. I was admitted to the hospital, had an MRI, had my pacemaker reprogrammed, and had an injection all within 3 hours.
Oh, wow.
Now, in 4 days, it's going to be 1 year since I got hurt at the Royal Stadium.
Uh-huh.
And KU Work Comp System has done zip buckets for me.
I'm so sorry.
It's not your fault, Melissa.
Well, I'm so sorry you're having that deal
They have
with
done
it.
buckets for me. I actually went and found my own surgeon. And I noticed that the notes from the last time I was here did not indicate the entire conversation that I had with the doctor.
Okay.
And that's something I want to address with the note taker today because I want to tell my wife about it.
Okay.
You know, my wife worked in surgery 20 years. She understands it.
Okay.
Okay, does that make sense?
Mm-hmm.
I
Absolutely.
mean, she was in the operating room for 20 years, a little over 20 years. She understands it. She
Sure.
worked with the orthos and neuros, the cancer doctors, the whole bit. And so she understands it. She just couldn't make it today.
Okay.
And she was here last time, but there was such a stall that her blood sugar was out of whack. She could feel it coming on, so I sent her a quick trip. And just in that amount of time, I got called in here.
Of course. That sounds
So I've
about
got
right.
some questions about things the doctor had said that were not in the notes. And
Okay.
so that's my question for the note taker is how do you determine what goes into the notes? Because I want to tell my wife,
Sure.
right?
Right.
Okay. Does that make sense?
Absolutely.
Uh,
So you were only at St. Luke's for hospitalization on April
18th?
18th.
Right, right. And I spent, I think, 2 nights in there. KU, I had previous back surgery, and on my right side in 2020, I think, 2019, 2020, and my personal doctor was still treating me because the sheath around my nerve down my right leg had rubbed raw, and I was honest about the fact that she was giving me medication. They were just 10 milligrams. And the prior doctor, Dr. Burton, and the staff at KU Work Comp called the DEA on my personal doctor and ruined her life.
Well, I don't
That was a
know
terrible
anything
thing.
about that. I'm sorry about
Again,
that.
it's not yours. You know, you don't own it. You didn't have anything to do with it. I've never met you, and you're such a delightful person.
Well, thank you.
Most nurses are.
Well, thank you. Do you know your weight, my dear?
I'm going to guess about 210.
Okay.
I've gained about 30 pounds in the past year because I just literally can't do
Can't
much.
move. Yeah.
Yeah.
So what's your pain level today? 0 to 10?
I'm about an 8 today.
8. Okay.
Right.
All right, honey.
And
Well, let's get some
I
blood
literally
pressure.
have to sleep on ice packs.
Oh.
My wife has gotten up every night during the night and changed up my ice packs because KU had refused to give me any sort of oral medication. They couldn't, the anesthesiologist that was giving me the back shots couldn't hit the right spot until I went to my own surgeon, and my own surgeon said, yeah, it's right here at 4 and 5. Now it's a completely different story. It's deteriorated more. But up until the time I'm hurt my back, I'm an guy. I was walking a mile, 2 miles every day.
Mm-hmm.
I was going to the gym and running the circuit.
Mm-hmm.
Not heavyweight, but I was going.
Yeah.
I've been an active guy all my life. I used to run. I'm a canine handler, so I used to run my dogs.
Sure.
I've just been an active guy all my life, and this has been really, really hard for me. It's been hard for me, not only physically, but really hard for me mentally.
I imagine it was.
To be literally stuck in a chair
all the time.
All the time.
When you're not a sitter.
My back is raw, and I had to buy my own TENS units, and that's plural. That's 2.
Yeah.
Okay. Plus all the pads, and the pads eat my back alive.
Okay.
So the
Like
pressure's going to be a little bit high today.
Fair enough.
You can see I'm kind of upset.
I can tell that, and I'm so sorry that that's all happening to you.
Again, it's not your fault. You've been absolute delight with me. So, and most of the young ladies in medical care are delightful.
Well, that's good.
I mean, women just have a higher capacity for being delightful, especially during stressful situations.
Well, I try.
Especially if you've got children, or
Oh, if I had a magic wand and could make people feel better, I would do it.
Exactly what the attending physician when I went into St. Luke's told me after he talked to me, and the anesthesiologist told me at separate times. Told me that it sounded to them like I was being victimized like elder abuse.
Wow. Okay.
Now I don't know these guys.
Sure.
Okay.
Yeah. I mean that's wow. Okay. Let me get this real quick.
So I looked up the definition. I looked up case law, and I'm thinking, why? I didn't want to come out here to begin with. I told my employer, I don't want to go. I'll go to my own doctor. I don't want to go. And they literally forced me to go if I wanted to work. They forced me to. I didn't want to go. I didn't ask to go. I never asked to go to the doctor. That's why I'll take care of it myself.
So it's a little elevated, not too terrible. 150/76. Higher, not as high as I expected, actually. 94 for oxygen, 106 for pulse.
Yeah, I haven't really had a chance to breathe this morning, get out and breathe the air,
Uh-huh.
And the air conditioning in the truck on the way over, and But I don't smoke, I don't drink,
Well, that's good. It's drama you don't need.
I tried some of the THC edibles for pain relief, and the CBD and the Creighton, all over the counter stuff. And the THC, because I've got ADHD and I get really super focused on things, all it did was make me super focused on the pain.
Well, that's counterproductive.
Literally, the night before I had my wife check me into St. Luke's in April, I haven't had a drink in 40 years. That's 40 years I haven't had a drink. Okay, not even a beer, a glass of wine, nothing. I drank a third of a bottle of Jack Daniels.
Yikes.
And ate a 50 milligram edible, and I could not knock myself out. It would not relieve the pain. All it did was make me sick and give me a terrible hangover the next day.
Sure. Still taking the Xanax as needed?
Yes.
And the ibuprofen as needed?
Actually, it's oh doggone it, it's
oxycodone?
No.
No?
It's not aspirin. It's the other. I can't think of it. But,
not ibuprofen, Tylenol?
Yeah, it's kind of like Tylenol. Yeah, it's Tylenol, and it's I take Tylenol and
Excedrin?
Doggone the little blue pills. They're I can't think of the name of them.
The Xanax?
No.
Blue, Aleve?
No.
Naproxen?
That's it.
Okay.
It was on the tip of my tongue, but
No judgment. It was hiding. Must have been on the bottom tip.
yeah. Well. I was trying to think of the over-the-counter name for it, and I couldn't think of it.
No worries. It's still Walmart and Independence?
Yeah, and I'm going to change that to CVS I don't know why I'm telling you this because you're not going to give me anything anyway. But I'm going to change anything to starting first of the month to CVS at 39th and Nolan, Independence, Missouri.
Okay, and do you want me to go ahead and put that in here today?
Yes, please. That would be very. I brought it with me. I just forgot to bring it in.
No worries.
But yeah, it is CVS at 39th and Nolan in Independence, Missouri.
I got it.
It's not like they're going to give me anything for pain anyway. So, and also tomorrow, I'm scheduled at St. Luke's at 7:30 in the morning.
Okay.
For another injection in my back.
Okay.
Out of my pocket.
Okay.
I literally had to cash in my wife and I's last retirement fund.
I'm so sorry.
Just to try to get some pain relief. But 3 out of 4 shots they gave me down at the main campus didn't work.
That's crazy.
And if I had not been in, when they laid me flat, my nerves all cramped up on me. There's a name for it, but anyway, I went into that, and they literally had to hold me down, and then he gave me the injection for L4 and L5 and settled it down quite a bit. But I went for 5 months and didn't see a doctor, didn't hear anything from anybody.
Wow.
And it's been extremely rough on my wife. I mean, we're 66 years old. She shouldn't be having to get up every night because the doctors don't want to do their job, because the insurance companies tell them what to do. And that's what it boils down to. You and I both know that.
Yeah. Have you had any falls?
No, I don't go anywhere.
Well, good. You don't use a cane or walker or nothing?
No,
like
but
that?
I did for the first 3 months.
Okay.
I couldn't literally not work. A big day for me is going to the grocery store.
Okay.
Also, I'm getting pain down my tailbone now.
Okay.
And it's starting to come into my right leg again.
Okay.
So.
Any hearing aids?
No.
Okay.
No. I've listened to a teaching video, so I'll take my earbud out.
Oh, no, you're all good. Any contacts or eyeglasses?
No. Okay. I mean, I have them, but I don't, it's just for reading.
Any weight loss recently without trying?
I wish.
And since you're active on my chart, is that a good way to provide education to you?
Can you speak up, please?
Since you're active on my chart, is there a good way to provide education to you?
Yes.
Okay.
Yeah, I look at them. They'll send me a text message or an email, and I'll look at them.
Okay.
I'm just really, I wish I had never, the Royals basically told me, if you don't go, we're not going to let you work. Okay? And I should have just told them, hey, look, you know what, I'll just quit. Okay, I don't need the job. I do it for fun. I do it for exercise,
Yeah.
It was more of a social thing. Like I would see people that I haven't seen in 20 years,
Right.
Guys I went to high school with, that type thing, guys
Yeah.
I grew up with. Everybody comes to the ball game, right?
Sure. Any other symptoms that you haven't mentioned?
No, outside of this has made me extremely depressed, and I'm literally bone on bone, and this hurts worse than prostate cancer.
Oh wow. Okay.
I mean, I know you can't really, having not been through it, you can't really understand that.
Sure.
But as a man, I'm telling you, this hurts worse than prostate cancer.
I'm so sorry. Well, I will get him in here, and hopefully we can get you something to help you. And I do have one form I'm going to bring you as well, but
Okay.
Thank you so much, friend. I appreciate you.
Thank you for being delightful.
Thank you. There you are, my friend.
Okay, what is this form?
This is just the pain form that we ask you.
Oh, okay. Okay,
Yep.
very good. All right,
Yep.
thank you.
Thank you.